Welcome to NUCD 2022. In today's session, our theme is nutrition and diabetes. You have already heard to some important talks. I have now very important duty to interview one of the finest endocrinologists of the country and with huge clinical experience, Dr. SK Sharma from Jaipur. Welcome to these interviews, Dr. Sharma.
Thank you, Thank you, Dr. Kanungo.
Dr. Sharma, now there is a lot of discussion. Everybody, more patients are discussing than doctors that diabetes can be reversed.
Yeah.
What is your take on that? Can it be reversed?
I think it is a very important question, Dr. Kanungo. Earlier, we used to say that diabetes is a chronic disease and it is a constant and permanent disease. And once a patient is diabetic, he will remain diabetic. But recently, for the last 10 years or so, we have got significant data and studies telling us that we can reverse diabetes, we can revert diabetes. So now our emphasis is particularly on newly diagnosed type 2 diabetic patients where they are slightly obese or obese, they have short duration of diabetes, and they have milder hyperglycemia. These type of patients are given a very intensified lifestyle measures, particularly as you rightly highlighted, lifestyle measures, particularly in the field of caloric restriction. And once they lose weight, a weight loss of something like 10 to 15 kg within a short period of 2 or 3 months, many of these patients revert back to normal. Their fasting postprandial glucose profile as well as 3 months of average HbA1c also revert to normal. So now we have started using this term of reversal of diabetes.
But do you think reversal is genetic also? Can patients, those who are genetically predisposed, immunologically predisposed, autoimmune predisposed, can they be reversed?
As we all know that diabetes is of different types as classified like type 2 diabetes, type 1 diabetes, MODY, genetically challenged diabetes. So here you find that those patients who are type 2 diabetes and overweight or obese, they are in this range of to be converted into normal glucose tolerance. People like type 1 diabetic patients, MODY patients, or patients who are suffering from secondary diabetes, or those patients who are having long duration of diabetes and lean and thin, they have really not shown good response in the field of reversal of diabetes.
Then a question comes to my mind that what is reversal? Then what is remission?
Well, reversal,
we know that when blood sugar comes down and it doesn't come up for some days, for months together, we think diabetes is remission. So is there any difference between remission and reversal of diabetes?
Well, most of the time what happens, we use these two terms, reversal and remission, interchangeably. But if you look carefully, we know we are using this term reversible. Once remission is there or reversal is there, there is a finer difference between them. Remission means after some time, these patients may revert back to hyperglycemia and type 2 diabetes. But reversal means probably they will remain free from diabetes. These are the finer difference. Otherwise, most of the time, literature is interchanging them.
Means that can be one patient can have reversal or remission in different stages of life.
Absolutely.
As one of the speakers recently told that there is a reversal, means when the patients are going for reversal, again they are coming back to normal stage.
Absolutely. Actually, now a concept of de-differentiation of beta cell is there. What happens because of lipotoxicity and glucotoxicity, the beta cells are not able to cope up with this load and they differentiate into null cell. So earlier we used to thought that probably there is a loss of beta cell, but now this concept of de-differentiation is there. So if the lipotoxicity and glucotoxicity is used, then these cells start behaving like normal cell, not beta cell. So they do not produce insulin. But once you take care of lipotoxicity and glucotoxicity, after some time, they de-differentiate into beta cell and they start producing insulin secretion. So probably genetic genes which are regulating the insulin secretion is inhibited because of lipotoxicity and glucotoxicity.
So these two metabolic things are very important while discussing remission or reversal. So scientists always discuss that there is a twin cycle hypothesis.
Absolutely.
So this is a little intricate. Can you throw some light on that?
Absolutely. This is a new concept of why the diabetes is developing. And once you revert it, you may bring the patient back to normal glucose. So they say that because of nutritional overload, there is increase in nutrition, increase in lipogenesis, and liver is also having huge amount of you can say adiposity and lipogenesis there, and de novo lipogenesis is also occurring in the liver, and because of this the hepatic glucose output is continuously there. We all know that insulin inhibits hepatic glucose output, but once the patient is having de novo lipogenesis and fatty liver and fatty infiltration, then you find that insulin is unable to produce inhibition of hepatic glucose output. So because of excess glucose output from liver, there is a continuous stimulation of beta cell and there is a fasting hyperinsulinemia. And in the presence of insulin and excess of nutrition, liver keep on producing excess of de novo lipogenesis. And once liver is full of lipid, then it starts secreting VLDL1 triglycerides. So VLDL is going from the liver and going to the periphery. Once the peripheral adipose tissues are saturated, then this VLDL is deposited into ectopic sites. And one of the important ectopic site is pancreas. So you find that pancreatic beta cells are also having huge amount of lipid. Particularly, they say if the patient liver is producing de novo adipogenesis, then palmitic acid is secreted in large amount. And this palmitic acid as a triglyceride is inhibiting beta cell. So now what happens? Beta cell is not able to respond to glucose. And there is a continuous declining beta cell insulin secretion. And this is twin cycle. One is hepatic cycle and the other is pancreatic cycle. So it starts with excess nutrition. Lipids are deposited in the liver. This is lipid cycle. Then lipids are going from lipid to the periphery, ectopic adiposity, and then pancreatic beta cells are damaged and they are de-differentiated into null cell and they do not produce insulin. And now what happens? You have a diabetes. And now you can reverse the process. How come? You start reducing significant amount of calories. So once you have significant decrease in caloric input, within a short period, the liver will start showing a decrease in fat. So the liver fat will rapidly decrease. Once liver fat will decrease, the VLDL from the liver will decrease and the ectopic sites are now, you can say, removed from the deposition of fatty acids. So you find that first there is a recovery of liver followed by ectopic sites like pancreas. So now pancreas also started de-differentiating and showing increase in insulin secretion. So you have better liver and better pancreatic function.
So that means once the calorie intake is reduced, weight reduction is there, and together there is a metabolic change, and this hepatic cycle is also controlled, and ectopic sites starts relieving the fat content and they start operating normally.
Absolutely.
This is the basic pathophysiology or mechanism of this change.
Yeah.
So, do everybody respond to this?
No, not all the patients will respond. I can just throw some light. Those patients who are having shorter duration of diabetes, those who are type 2 diabetic patient and younger patients, and those who are overweight and obese, these are the patients where you find very good results. So most of the time we see good results once the patient is having shorter duration, like less than 4 years of diabetes, and their HbA1c is not very high, and they are younger in comparison to other patients. And once you give them this diet restriction, and they have some 10 to 15 kilogram of weight loss within a short period of 2 to 3 months or so, then they will revert back to normal glycemia.
And to maintain that normal glycemia, what do they have to do?
In studies, what they have done, they have started increasing their diet, but still they provide them a very tight dietary schedule and physical activity. And as we all know that it is very difficult to maintain the lower weight. Most of the time, what happens? You have gradually increasing weight after some time. So that is again a very big problem in these patients. Till now, we have seen a documentation of 2 years of reversal of diabetes in direct study. So that is, we hope that if the patient maintain his weight, then he may have normal glycemia for a longer time. But at present, we don't have much data more than 2 years.
So this is not a general recommendation to all diabetics.
Yes, absolutely.
It has to be chosen by the physician or the treating doctor, and he has a choice to select the typical patients.
Absolutely.
So, what evidence does the reversal cause creates so that a physician can tell now you are on the reversal of diabetes? What are the evidence for the clinicians?
For the definition of reversal, we say that fasting should be less than 126 mg%. The HbA1c should be less than 6.5%, and patient has lost something like 10 to 15 kg of weight, and they have stopped using their drugs. And you can repeat the HbA1c after let's say 6 months, and it is maintained there. Then we say that it is reversal. So you have to wait for 6 months or more. Fasting and HbA1c remains low, normal, in normal range, and they are not taking any oral anti-diabetic drugs. Again, one important point is it is seen in those patients who are on oral drugs. Those patients who are on insulin, type 2 diabetic patient, we all know that they have longer duration of diabetes and very severe diabetes, very high HbA1c. The chances of them reversal is very, very low.
Low. Yeah. So, Dr. Sharma, you have highlighted that low calorie diet is the key to reversal of diabetes. So there are, as we know, very low calorie diet and low calorie diet. Absolutely. What is the difference and how do you recommend that?
Well, people have divided this low calorie diet like very low calorie diet where 20 to 50 gram of carbohydrate is given. Then low calorie diet 50 to 130 gram per day. And then normal diet means where we say that it is 130 to 230 gram of carbohydrate, and high carbohydrate means more than 230 gram per day. So depending upon the amount of energy derived from this carbohydrate, we say that it is very low or normal or very high carbohydrate. So now people are looking into whether it is only the caloric restriction or carbohydrate restriction. So at present, we have evidences for both. But in diabetic patient, people are arguing that probably carbohydrate restriction is showing better results as compared to caloric restriction.
Carbohydrate restriction will not cause hypoglycemia.
Well, you have stopped giving oral anti-diabetic drugs to them. So you stop the drugs right from the beginning of this, you can say, trial where you want to revert the diabetes. So once you are not giving any oral anti-diabetic drug, patient will not develop hypoglycemia.
But if you do not give any drugs, there will be increase in blood glucose maybe in some cases.
Well, absolutely.
So how do you handle it?
Yeah, that's why what happens, we usually select these patients like they have milder hyperglycemia, short duration, they are not on multiple oral anti-diabetic drugs, and they do not have insulin on board. And even if they have, you can say hyperglycemia, you can use a drug like metformin. So you can use metformin for some days and weeks, and after let's say 7 to 14 days, because within a period of 7 days, liver fat is reduced by 30%. So that twin cycle is now started reverting back. So you find that improvement starts occurring within a period of 7 days in these patients.
Very nice. Talking to you has been a great pleasure. And very quickly, role of insulin resistance, adipose tissue dysfunction, and metabolic syndrome. 1 minute, please.
Absolutely. So this is a newer concept where adiposity related chronic diseases model are now coming in, where excess of nutrition, excess of adiposity leads to development of insulin resistance. And this is then further progresses to metabolic syndrome, and many of our patients further progress to type 2 diabetes. So this is a continuum. And if you further go, you find that complications of diabetes and complication in the form of cardiovascular diseases are also higher in these patients. So insulin resistance, metabolic syndrome is now very closely linked, and they are also important cause of cardiovascular diseases and risk factors like hypertension, dyslipidemia, and type 2 diabetes. Thank you.
Dr. Sharma, there are a lot of advertisements that come to us will reverse your diabetes.
Absolutely.
So
now this is a very
about that popular advertisements by not so qualified people.
Absolutely. So our message to our friends and our patients are that they should be not generalizing it. Look at your profile, go to a qualified doctor, and then try to achieve this reversal. So as we discussed, shorter duration of diabetes, milder diabetes, overweight or obese, not on multiple oral drugs or insulin, and then of course you may have reversal of diabetes. Thank you.
Dr. Sharma, for your excellent interview, and we will be meeting again in the panel discussion.
Thank you, sir. Thank you. It's always a pleasure to be with you. Thank you.
Thank you so much.
Good day.
Good day.